Hi, I'm Danielle Dick, and I'm the director of the Rutgers Addiction Research Center. And it is my pleasure to be here today talking with Denise Hien, who's the director of the Center of Alcohol and Substance Use Studies. But in addition to that role, Denise plays a whole myriad of other roles across the university. So, Denise, I'm going to turn it over to you first to talk about your affiliation with different departments and your leadership roles that you play at the university.
Well, thank you, Danielle. It's my pleasure to be here talking to you about the center and all of our activities. And yes, I do have a number of different titles and roles. So one of them is I'm the endowed chair of the Helen E. Chaney Chair in Alcohol Studies here at the center, as well as a distinguished professor in the Graduate School of Applied and Professional Psychology in their clinical psychology department. And I also serve a leadership role in our Rutgers-New Brunswick Chancellor's office as the Senior Vice Provost for Research.
I know you've been invaluable as I have settled into the university and been trying to learn about, the vast landscape that is Rutgers, and have been such a wonderful partner. So maybe let's start with, can you tell everyone a little bit more about your center?
Yeah, so the Center of Alcohol and Substance Use Studies has been at Rutgers since 1964, and prior to that actually was started in the 1930s at Yale University. So we have a long history of being involved in shaping addiction research. Specifically, we started as an alcohol studies center. So a lot of the original alcohol research that was done in the United States was done by the founders of our center. And over the course of time, once the center became a part of Rutgers University, the Smithers Family Foundations funded both programs as scholarships and postdoctoral fellowships and other kinds of funding to allow us to bring in speakers and do addiction prevention, alcohol prevention research, as well as clinical research. But in addition to that, the foundation gave a substantial donation that enabled us to build Smithers Hall, which is where I live and where many of our faculty do our work, as well as Nelson Hall, which was a predominantly, clinical trials space where we did research here. And we have a very long history, and our website has a wonderful timeline that kind of goes into all the details. But I think one of the big pieces that's important is that we, really shaped for the nation the kind of bringing recognition to the importance of studying alcoholism and other substance use problems from a research perspective, legitimizing it, providing a historical understanding. So we have an incredible digital library now that charts the course of addiction research in our nation. And in fact, the founders were involved in shaping the National Institute on Alcohol and Alcohol Abuse. So we existed before the NIH actually had NIAAA. And the other thing that we've been very involved in is education and training for the workforce. And so we were the first summer school of alcohol studies that provided training for professionals who were developing, and it was really the peer workforce, but also professional, from MDs to psychologists to social workers to people working in all kinds of agencies would come here for a 3-week summer institute. And it was the only institute of its kind. So again, elevating education and scholarship in the area of addiction studies. And over the course of time, we became the summer school for addiction studies, sort of becoming more broad. But as part of being housed within an undergraduate institution, many of our faculty, Gail Milgram was one of the leaders here in education, established in partnership with the university, our current ADAP, which is alcohol drug assistance program in our college counseling, as well as recovery house that exists to this day. Rutgers was the first recovery house for students struggling with substance use issues to be able to be in a sober living and supportive environment, and foster their success as college students. So there's a lot of things that the center originally has established that now, we serve as a model for other Big Ten institutions, or other colleges and universities come to us for our what we've done in those areas as well. So sorry, that was a really long answer.
No, I know that there's a long history here, being someone who also does a lot of alcohol research, and especially then when I was talking to other colleagues in the field about coming to Rutgers, it's striking how many people in our fields, senior people that have shaped the field, all came through Rutgers and trained at the Center of Alcohol and Substance Use Studies too. So I know that under your leadership, you also really have focused a lot on community engaged research, as well as a focus on trauma and substance use, your own area of research. Could you talk a little bit more about the direction and the way that you've shaped the center since you took over as director?
Yeah, happy to. So when I was recruited by the dean of GSAPP, which is our graduate school, who has now since moved into and is the chancellor of the university, but she recruited me here and asked me to provide a vision statement. And my vision statement, because I am a trauma researcher and have worked on developing and testing interventions for traumatic stress and its relationship to substance use, basically for my entire 30-year career, that's been my area of focus, and where I've done a whole set of different clinical trials to figure out both what can we do to help individuals who have trauma and also addiction, who come from underrepresented minoritized backgrounds. So I started my work in New York City, in the upper Manhattan, Washington Heights, and Harlem communities, which are predominantly minoritized communities where trauma and violence was part and parcel of the experience of many individuals who live in poverty or so on, and addiction was always interconnected with that. And so I was involved for a long time in trying to figure out both what can we do to provide support and help for the communities, and also then once we knew which kinds of interventions were best, we always have this problem of the implementation cliff, which is that certain treatments, in my case, a lot of them were behavioral, but some of them were combined behavioral and pharmacological therapies, that they work, but providers were not willing to adopt them. And why, maybe sometimes because they weren't culturally tailored or culturally sensitive, or maybe because there's a lot of fear around trauma and whether treating trauma would potentially lead to relapse. And so the prevailing idea when I first started, which was maybe in the late 1980s and 1990s, was that you can't, people have to get sobriety before they can get any treatment for their mental health problems. But of course, if their mental health problems are causing them to use, which in the case of trauma and post-traumatic stress is often the case, is that the trauma predates the substance use, and it's really a self-medication initially that maybe eventually becomes a problem, unto itself. If you don't treat both, then you can't help the person retain or maintain or even get into recovery. And so for all those reasons of the barriers, I also have been very devoted to trying to find ways of bringing community in partnership with research to try to solve these problems of dissemination and adoption. And so I led the largest clinical trial in the community as part of the NIDA's clinical trials network. In the early 2000s, it was called the Women in Trauma Study. And so we did it across 7 different states. and taught providers how to do a trauma intervention called Seeking Safety in the community. And then they delivered the intervention, and then we evaluated the outcome and showed that you could safely do those kinds of interventions. And so, yes, that's been part of my vision, to have our center focusing on, research that addresses trauma in various ways. So we have people that do experimental research, people that do genetic research, people who do community-based clinical trials within our center. And we also have a kind of focus on how do we engage our community in the process of doing research and co-production of research. And so my associate director, Dr. Peggy Swarbrick, is a wellness and peer workforce specialist who's worked in SAMHSA and devoted her career to making sure that voices of those that we try to treat are included in the process of developing interventions. And that's one mechanism for promoting dissemination. And so our whole, we have changed our sort of focus so that we're really working on a wellness and recovery model that I think is another part of the vision for the center going forward into the future.
This idea of working with the communities that, many of us who go into research are trying to help, right? We're trying to reduce the burdens associated with substance use disorders. But it's, when you step back and think about it, it's almost surprising that for so often researchers, it didn't occur to us to actually work with those communities to find the solutions and figure out how best to develop treatments, disseminate them, et cetera. Why do you think that is?
Well, I think that even if people recognize that it was important, it's hard to do it. And so part of it is the infrastructure and the mechanism. So even more recently, our National Institutes of Health and basically across the board, people are starting to really tune into the fact that we've spent a lot of money on testing and developing interventions, but they don't make their way back to the people who need them as well as they should. And certainly during the pandemic, we all became very aware of the hosts of inequalities in healthcare access and healthcare that could be provided to communities that were not willing or trusting in what the medical fields were wanting to put out. And we saw that with the uptake, access to, but also uptake of the vaccines and other kinds of healthcare phenomena, and also people, having poor healthcare. And so if they got COVID, we're much more likely to have damaging, either, morbidity or mortality in relation to the pandemic. So that sort of has become very crystal clear to all of us. But I think that some of it has to do with what we'd call social determinants of health, and those kinds of barriers of poverty and lack of access to transportation, lack of access to good health care, and also, communities being disenfranchised from research and being not trusting in the medical establishment. So those are lots of reasons that people don't seek the care. And then also in our addiction field, we all know well about the stigma. And even though I would guess that we all can have at least one person in our close orbit, if not more, who have struggled with substance use, it's still not something that people really feel like they can talk too much about. And maybe the opioid crisis and epidemic has allowed some people to talk about it more, but I still think there's a lot of stigma and shame associated. And for poor communities of color, even more so. So I think there's lots of reasons that are not, the investigator's fault, but then there's the reality of it's really hard to do any clinical trial and get, whatever participants you're trying to recruit. And even if you want to recruit a diverse sample, you may have a difficulty doing so for a lot of these other reasons right? And so then we inadvertently perpetuate. And also it's really hard to engage the community. So people have been doing community engage participatory research for a long time, but it takes longer. May take years to cultivate a trusting relationship with an agency. You're not being able to fund the agency. So there's those types of barriers that make it hard to actually do it, even if you want to. And then there's also like, maybe you don't have the skills to do so. So I think it's exciting that there are all these new mechanisms now that will allow researchers to get more consultation and partnership with community. And you know that we are working on being made, perhaps having one of those kinds of grants coming our way. But even if we don't, I think there's more and more recognition across the board of the importance. And so I don't think it's any person's failing to consider community, but it's just hard to do it all.
Yes. So for the junior researchers, or perhaps aspiring researchers out there, talk a little bit about your career and how you ended up where you are today as the director of the Center for Alcohol and Substance Use Studies. What led you to go into research?
Yeah, well, I tell the story of, my original applications to graduate school, and the fact that I went to Columbia University, the doctoral program there, in the 80s, which was very psychodynamically oriented in terms of theory. And I wrote that I wanted to become a full-time psychoanalyst. So I had no intention of becoming a researcher, but it was through the course of training. And this is one thing I tell a lot of my students, is that you just don't know. Like, that's what graduate school is great, because you will become exposed to things, and you have to be open to, when you're in your early 20s, or I was, it was like, I had no idea that I would have such a passion for doing research. But through the course of both a job that I had where I worked on a large NIMH clinical trial called Treatment Strategies in Schizophrenia, which was one of the big studies that tested medication and problem-solving skill development to early first break individuals who had been diagnosed with psychotic disorders and their family members. It was an amazing experience. So I was exposed to that. And also I was a grad student, and I had to do my master's thesis and my doctoral. And so one thing led to another. And even though I never saw myself as an academic, that's what it turned out to be. And then, I also was lucky enough to have a lot of great mentors who supported my burgeoning research ideas when I was a postdoc. And I did my postdoc in the Division on Substance Use at Columbia University as well, which was a different part of the university, but got exposure to amazing people, and then could formulate ideas that I cared about. And treating trauma in the community was one of those ideas that ended up taking hold. And I was able to get NIH funding, and I will say that I've been continuously funded, not 100% all the time, but since for 30 years. And so I got to really see what it was like to get the funding to do the projects that I really cared about. And so my message to people in developing the careers is to, never give up, and that persistence is the key, because you get rejected more than you get the hit, or at least I have more submissions by far than those that I've been, gotten to funding. But there's nothing better than having a vision to do something and then making it happen.
Yes, I remember that there was an article in the Chronicle of Higher Education some time back, and it's always stuck with me because it was talking about how one of the greatest predictors of getting grants, of grant success, is how many grants you write. How many grants you write correlated with how many grants you get. And I try and make it a point to post on social media and other platforms, not just, oh, very excited, we got a new grant and fill in the blank, but the grants that we don't get as well, because I think that, sometimes we can inadvertently contribute to this idea of, oh, here, when you're a successful academic, you write grants, you get them all. And to hear
Right.
you, and I know it's been my experience as well, say, yes, we've been fortunate to have successes, but there's also a lot of things that we try that, don't immediately get accepted as papers, funded as grants, et cetera.
Yeah.
I think that's an important thing for early career investigators to realize as well, too.
Right. And I will say, in terms of thinking about the future for our center, we're in the process, as you know, of writing for a center grant. And we are hoping to use data science and leverage data science to address health inequalities in substance use treatment research. And so we're building out a center grant application, and we have a number of people who will be contributing from across Rutgers and also outside our institution to this research methods and center that we're calling the Edge Center. So that's a vision that we have of addressing equity and discovery using big data as a means to provide training and dissemination of methods and for underrepresented scientists as well as our communities. But we may not get it, and it will take years, even if we do have a good fortune with it. But just like with other grants that I've written, and I'm guessing you've had similar experiences, most of them have, whether we got them funded or we didn't, through the mechanism that we tried to, they've led to some set of somethings that ended up bringing people together and getting done in one way or another. So I never think it's not worth trying to pull together and go for things, because the outcomes are just not predictable. So it might not be what you actually thought you were going to get, but then it helps you spin off and do other things, or it has created new collaborations that didn't exist before. So those are the kinds of things that, in my mind, the function of doing it is the process itself, not just the outcome.
Yes. So where do you hope your center, maybe the field of substance use research, will be in another 10 years, 20 years? What do you think of as where, from looking back at the beginning of your career, you talked about starting out in a world where it was psychodynamic research, about how far we've come in terms of understanding, trauma, substance use need to be treated simultaneously. Where do you hope we'll be in another 10, 20 years?
Well, I'm hoping that, contrary to many who might feel like machine learning and artificial intelligence is going to doom us, in the world, I feel like pooling resources and using new technologies will only help us to determine and have a more precision-based approach that's more individualized, so that we can tailor which treatments will work best for which individuals, and hopefully engaging individuals in choices and being actively able to make choices about what kinds of interventions they want to engage with, but so that more people have access to a host of efficacious interventions that can help with individualizing approaches. And so that will require not only us having those interventions, but also having the science to be able to look. And that's where I see big data as being really important, for us to be able to look not at an individual level, but at more population level, or heterogeneity in the kinds of, approaches that would be best for the types of persons. So whether that's like through our having better ways of mapping the brain that can then be incorporated to say, oh, well, you're the type of person who thinks, has a strength in this area of, let's say, executive function. And so this type of treatment could be a good match for you. So getting to that level of granularity to be able to, and also for people to choose which treatments they want, and maybe to be able to change the treatment if the one that they've chosen is not working for them. And so all those kinds of things, I think, require advances in our knowledge of body and mind, and incorporating that into our space. And then what I would hope is also that it's not going to be in 10 years, but people recognize more about this, the impact of stigma, and make getting services more part of health, just regular health care, as opposed to, it being sort of set aside as some specialty.
Well, I share that vision, and I look forward to working with you to hopefully move us as a field closer to it. So where can individuals learn more about your center and all the exciting work that's going on there?
So we have a website, which is probably the best way to gain access to that, and that's www.alcoholstudies.rutgers.edu.
And there is a link, I know, through the Rutgers Addiction Research Center to your center as well. Thank you so much for being such a wonderful partner, for your leadership in the field and at the university in so many of these areas related to substance use and mental health, and personally for being such a wonderful partner to work with. And thanks for your time this morning.
Oh, my pleasure, and the same right back to you. And it's very exciting having the Rutgers Addiction Research Center here, and everything that you're doing to kind of spread the word about the great work that's happening here, and also convening and bringing people together across the medical school and our other Chancellor-led units has been really amazing. So thank you for everything that you're doing as well.
Thanks, Denise.